Dr. Shannon M. Clark here. I'm a double board certified ObGyn and maternal-fetal medicine specialist, and I want to start out by saying I'm sorry. I'm sorry that it has taken me so long to do this video that I have been promising you on the FRESH test for screening for and diagnosing gestational diabetes, but I'm going to do it. So have a seat and listen up. I'm just going to start off by giving you a quick rundown of my assessment of the FRESH test, and if you want to find out why I feel that way, you keep watching and there's an explanation in detail. My first point is that the FRESH test is not widely available to everyone because for most people, it is an out-of-pocket expense. Yes, some people can get reimbursed and some people get it in their packaged pregnancy care in some offices, but it's still not widely available and it's not cheap. Second, both the glucola drink and the FRESH test contain dextrose, 50 grams and 100 grams. So assuming that they're equivalent, which the FRESH test says it is, and it's been validated as an equivalent, then where the real money is if the side effects are better. Because the reason anyone would take the FRESH test is to avoid all the extra things or harmful things that everybody says are in the glucola drink, which is actually not true because the glucola drink is safe in pregnancy. And we don't have any information as to whether or not the side effects are better with the FRESH test. So because I am a scientist at heart and a physician, my recommendation would be, if you can afford it and you are otherwise low risk, I think the FRESH test should be okay. But if you can't afford it, it's not. And if you're high risk or you have risk factors for gestational diabetes, I would stick with the traditional glucose beverage drink. Now, the FRESH test is available in a 50-gram powder and a 100-gram powder that you mix in 10 ounces of water. 50 gram is for screening for gestational diabetes and 100 gram is for diagnosing it if you don't pass the 50-gram test. The out-of-pocket expense for the 50 gram is $19.85 and for the 100 gram is $23.10. Now, regarding cost, I have done some DMing with the FRESH test, and they said that while a percentage of women or individuals who use our product do pay out of pocket, it is also stocked in hundreds of offices across the US and is either included within their care or reimbursable under insurance. So it depends. I don't know what percentage of their clients have to pay out of pocket and what percentage get reimbursed, and then what percentage they get it at the offices that they are getting their care from as part of their package of care. It's very important that screening tests, especially for something like gestational diabetes, be widely available to all individuals who need it, like those who cannot afford to pay out of pocket. When considering the traditional glucola beverage that is given in pregnancy, I found this ingredients list from Thermo Scientific, and I'm going to run down some of the ingredients. Dairy-free, free of wheat, barley, rye, and oat glutens, caffeine-free, certified kosher, non-carbonated, ready to use. It has water, dextrose, citric acid, and citrus. Does not contain any herbs, has a selected blend of natural oils. Flavoring contains no intact protein or DNA from genetically modified organisms. The beverage contains no gelatin and is gluten-free. It typically comes in lemon lime, fruit punch, and orange. Out of those three, the one that contains dye would be the orange one. And it has natural orange flavor number 3, which has FD&C yellow number 6 and FD&C red number 40. You can go Google this and look for yourself. Now, one important thing to consider regarding the FRESH test versus the glucola beverage. A lot of people think that the adverse reactions some people have to drinking the glucola drink is from all the trash that's in it, which is not true. It's from the glucose load. Drinking 50 grams or 100 grams of glucose/dextrose in one sitting can be hard for anyone to tolerate, even if it's coming from the FRESH test. Now, when I asked the FRESH test about any studies done in pregnancy, they mentioned a survey that showed that pregnant individuals liked the taste of the FRESH test better, but I'm not sure what they were comparing it to. But they did send me this clinical abstract, which I could not find whether or not it has been published in a peer-reviewed journal. But they looked at the effectiveness of the FRESH test to the existing one used by the laboratory. I'm assuming it was the glucola beverage. And they also used retrospective data to evaluate glucose tolerance test ordering practices and the incidence of GDM diagnosis by test options. The only problem is they used 10 non-pregnant, non-diabetic subjects, 1 male and 9 female. So still, again, no testing in pregnant individuals. So it would be really helpful to have a study, and I've said this before, comparing the fresh test to the traditional glucola beverage and look at two things. Number one, the performance of the test to make sure it's equal to or better than the performance of the glucola test, a drink, and then to look at side effects. Because if it's otherwise equivalent, they both use the same amount of dextrose, then the money is going to be, well, if they're otherwise equivalent, then are the side effects better with the fresh test because it has less ingredients. And as I mentioned in a previous video, and the fresh test confirmed it, the fresh test is not FDA approved for screening or diagnosing GDM. It is a validated equivalent glucose beverage to the traditional glucose beverage because it has the same amount of glucose / dextrose. It is an FDA registered product. And when they say on their website that it's not an alternative to the glucola, they're saying that because, as they say here, when most people think of alternatives, they think of jelly beans and other alternatives to testing, like any kind of confectionery methods like jelly beans, foods, drinks, and it's not considered an alternative in that sense.